Hi Professor, my name is Navdeep Kaur. Today I am going to present my capstone project on the topic of shortage of nurses in Ontario. Nurses are the backbone of healthcare organization, but nowadays the shortage of registered nurses is the main issue facing Ontario healthcare system. In Canada, Ontario has a fewer registered nurses as compared to the other provinces. There are the number of the reasons that contribute to the shortage of nursing. The first one is burnout and working stress. It is the main issue why nurses leave their profession because due to the shortage of the nurses, one nurse has to deal with the number of the patients that impact on physical and psychological health of the nurses. The second one is unequal distribution of nurse-patient ratio that creates a unfavorable working environment as well as stressful working environment. The third one is bill passed by federal government, that is Bill 124. This legislation suppresses the wages of the nurses. It also contributes to the nursing shortage. To deal with this problem, there are a number of solutions. The first one is nurse-patient ratio should be balanced and each task of the nurses should be allocated according to the department of the hospital. Second one is flexible workforce. This policy should be implemented in the hospital because it helps to unclog healthcare system in case of the emergency. The third one is orientation and regular training. It should be promoted because it helps to enhance the confidence as well as it will helps to provide the knowledge about the organization. Fourth one is repealed Bill 124. It should be repealed in Ontario as quickly as possible. I would like to explain the expected outcome of my project. First of all, I will explain the study outcome. It by implementation of the previous solution, it will help to enhance the retention of the nurses because by providing the flexible working hour and choosing working hour that will suit according to their needs, it will help them to stay longer on their jobs. The second one is giving the proper working hour and balance the nurse patient ratio. It will help to reduce the burnout as well as turnout of the staff. Second one is effects of the outcomes on leaders, staff, clients and families. If the sufficient number of the staffs are allotted to the hospital, it will help to improve the quality of care to the patient. That will provide the satisfaction to staff, client and family. Secondly, I am going to explain the act. I would like to change my leadership theory from situational theory to the transformational theory because I think that transformational theory is the best approach to deal with these issues because it focuses on the outcomes and promote the work happiness as well as it promote the culture safety. And also I will employ the transactional leadership style because it will help to enhance the retention of the nurses by providing rewards as promotional policies. But there are the number of the barriers that will impact on the expected outcomes such as lack of economic funds. Some organization and the hospital have no proper funds to retrain as well as hire the nurses. And second one is lack of organizational structures as well as policy. Some organization has a strict rules as well as policies that impacted on the expected outcomes. Lastly, I would like to explain the sustainability plan of my project. There are number of roles and responsibility of the leader to promote the sustainability plan. Firstly, leader will implement promotional strategies to retain the nurses as well as provide support to them. Second is all leaders should ensure the sustainability plan by ensuring significant economic resources and incentives to carry out the suggest change as well as implement the approach. Plan to ensure sustainability. Leaders should educate the staff about how to perform duty when they are under pressure, when they are shortage of staff, how to deal at that times. Second one is staff members should be educated how to work in a cooperation and how to make a calm environment. Third one is regulation should be explained to all the staff members such as about the promotional policies, benefits plans and the policies of an hospitals or the organization. References page. Thank you.